What happens when a single fraudulent applicant costs taxpayers $600,000 in just 1 year? And the system lets that exact type of fraud happen successfully 96% of the time.
It sounds less like a flawed program and more like a high-budget crime spree. But that level of vulnerability, that is exactly what's been revealed in this major new report from the Government Accountability Office, the GAO.
And today we are doing a deep dive into that very report, looking at the highly controversial world of Affordable Care Act subsidies, specifically the Advanced Premium Tax Credits, or APTC.
And the source material here is, you could say, explosive. This GAO report was actually requested by Republican leaders in the House.
Right.
And it confirms these massive, just systemic vulnerabilities in the federal health insurance marketplace.
So let's get the core finding out up front for everyone listening. What's the headline here?
The headline is a catastrophic failure of basic financial controls. I mean, the GAO, they didn't just analyze data this time. They went undercover.
Undercover.
Yes. They conducted covert tests. They created fake identities, 20 fictitious people, and submitted 24 applications for subsidized health coverage across the 2024 and 2025 plan years.
A full-on sting operation. So what was the result?
A 96% success rate for fraud.
96%.
Almost every single one. 23 out of 24 of these fake applications were approved for subsidized coverage. The report makes it so clear. The system is just bleeding taxpayer dollars. Through unchecked fraud, improper payments for people who are deceased, and a complete failure to verify income.
So this report is really the smoking gun for critics who argue the ACA lacks financial integrity.
It absolutely is.
Our mission today is to unpack this report, to really get past the headlines and quantify the staggering cost of this waste. And we want to show you precisely how easy it is for bad actors to fleece the system.
And this is all happening as Congress is debating whether to extend these subsidies, which makes these findings, central to that whole debate.
Absolutely. So let's start with the heart of it, the covert operation itself.
What's so fascinating is how deliberate the testing was. This wasn't just, one bad application. They systematically tested multiple weak points over 2 full plan years to see if the marketplace controls would ever catch on.
So they created these fake people to test the system controls in 2024 and 2025. And look, it's one thing for a fake account to get approved initially, but the system's supposed to catch them eventually, right? What was the retention rate?
That's the truly alarming part. The initial 96% approval is terrible, but the failure to follow up is worse. For the 2025 plan year, 18 of those fake enrollees were still actively covered as of September 2025.
Still active for months.
Months. It shows a failure to screen them on the way in and then a total ongoing failure to kick them out, even with all the red flags.
So how much was that small group of fake people actually costing the system every month?
Just those 18 fake beneficiaries were costing the government more than $10,000 per month, combined. And remember, these APTC payments go directly to insurance companies to cover premiums. So that was $10,000 of real improper payments going out the door every 30 days.
Okay, let's talk specifics. What techniques did the GAO use? What data should have instantly blocked these applications?
They started with the most basic check. The applicants used invalid, never issued Social Security numbers.
So completely fake numbers.
Completely fake. And they fabricated income claims to make sure they were eligible. This is the very data the system is supposed to cross-reference against IRS and Social Security databases instantly.
And that system failed.
It did. The initial identity proofing test, it just failed. But what's even worse is what happened next. The system gives you a chance to submit follow-up documents if you fail the first check.
A second chance.
Right. And the GAO submitted false identifying documents. And the system approved the coverage anyway.
So the marketplace basically gave these fake people a second chance, and when they submitted fake proof, it just looked the other way.
That's the outcome, yes. The GAO found the system prioritizes quick enrollment over any kind of real verification. In some cases, coverage was approved even when no documentation was submitted at all.
Not at all.
Or if the documents that were submitted were, internally inconsistent. It's like the system was on auto-approve for fraud.
And I see here in the source material, they highlight the abuse of special enrollment periods, or SAPs. Why are those so vulnerable?
That's a key loophole. SPs are for legitimate life events, losing a job, getting married. And because they require rapid enrollment, the verification bar is often much lower.
So the system just assumes you're acting in good faith because you're in a crisis.
Precisely. And the bad actors know this. The GAO was able to use the low-income special enrollment period to sign up outside the normal window, which just proves that these are the pathways fraudsters use to move fast and avoid scrutiny.
Now, we also have to talk about the broker vulnerability, because insurance agents and brokers can enroll clients, and the GAO found they were key to this as well.
Right, this brings us to the Enhanced Direct Enrollment, or EDE system. This lets trusted brokers handle the entire enrollment process without the client ever even logging into healthcare.gov. It's meant for efficiency.
But in practice,
In practice, the GAO found the fraud was just as successful. The real problem is this delegation of trust, combined with agents chasing commissions. In their tests, brokers got coverage for these fictitious clients without the fake applicant even being present.
so the broker acts as a trusted middleman, but if they're unscrupulous, they can just accelerate taxpayer money to insurance companies for clients who don't even exist.
That is exactly what the report shows. The EDE system, designed for efficiency, just becomes an efficiency pathway for fraud.
Okay, so the front door is wide open, but the report also reveals a back door that's costing exponentially more. We're moving beyond the $10,000 a month and into the billions now.
This is maybe the biggest financial failure they identified. The complete collapse of income verification through tax reconciliation.
Explain what reconciliation is exactly.
Okay, so under the ACA, your subsidies are based on an estimate of your income for the year. The government pays the insurance company that amount based on your estimate.
Seems reasonable as long as there's a check later on.
That check is reconciliation. You're required to file a federal tax return. On that return is your actual verified income. If you got too much subsidy, the IRS is supposed to claw it back. Too little, you get a refund. It's the primary control.
So where did that primary control fail?
It failed because the Centers for Medicare and Medicaid Services, CMS, intentionally paused enforcement.
They just turned it off.
They turned it off. They disabled that critical guardrail for 4 straight plan years, 2021 through 2024. No enforcement for people who failed to file and reconcile.
4 years. What was the rationale for a policy decision like that?
Well, according to some analysts, this was done to avoid roadblocks during the COVID-19 public health emergency. The priority became maximum enrollment over stringent financial controls.
So that policy choice is what created this multi-billion-dollar hole the GAO found.
Yes, and the cost of that choice is staggering.
How much are we talking about?
The GAO could not find reconciliation evidence for over $21 billion in APTC payments
$21 billion.
for the 2023 plan year alone. To put that in perspective, that is nearly 1/3, 32% of all subsidy payments for that year.
So 32% of the money spent in 2023 is just floating in the system with no confirmation it was the correct amount.
Exactly. CMS has no way to confirm those tens of billions paid to insurance companies were correct. It's a massive amount of money that can never be recovered.
And beyond that disaster, the report details some just unbelievably egregious examples of SSN misuse. Let's start with subsidies for the deceased.
It's audacious. In 2023 alone, the program paid out over $94 million in subsidies for 58,000 Social Security numbers that matched death records.
$94 million for people who were already dead.
And get this, in at least 7,000 of those cases, the applicant was deceased before the coverage even started. It's definitive proof of identity theft.
But the single most concise red flag has to be the single SSN scandal. It just shows a total failure of basic monitoring.
It really is the definition of a broken system. The GAO found one specific case where a single Social Security number was used to secure 125 different insurance policies in 1 year.
125.
It generated the equivalent of 71 years of coverage in just 12 months. That one SSN cost the government about $600,000 a year in subsidies.
The system should have flagged that after the second or third attempt, not the 125th. So what was the agency's response when the GAO confronted them with this? With proof of $600,000 in fraud from one SSN.
This might be the most telling part of the report. The CMS officials, they declined to act. They said they didn't want to kick off the wrong person.
You're kidding.
No. They cited the administrative burden and the possibility of inconveniencing a legitimate enrollee.
So they're prioritizing process and fear of a complaint over their basic duty to the taxpayer. It signals that catching a criminal is just too much trouble.
It's a fundamental failure to prioritize program integrity. It's a green light for criminals.
And this isn't just theoretical waste. It harms real people, doesn't it? How does this affect the legitimate consumer?
It hurts them directly. First, all this waste inflates the overall cost of the program. And second, patients can face higher costs and denied claims because providers struggle to verify who has valid insurance.
And we keep hearing about these unauthorized plan switches, often tied to agents chasing commissions. That seems to be another integrity flaw.
A massive one. The numbers are startling. In just 8 months in 2024, CMS got 275,000 complaints about non-consensual enrollment or plan switching.
250,000 people.
That's the real-world consequence of a system that rewards volume over verification.
Okay, the political context here is impossible to ignore. This report gives a lot of fuel to the argument that the ACA is structurally flawed. And we see some very strong language from the Republicans who requested the investigation.
Oh, absolutely. The report is framed as confirmation of their critiques. For example, Judiciary Chairman Jim Jordan said, and I'm quoting here, "Under Obamacare, hardworking Americans saw their premiums skyrocket and their health care choices shrink, all while fraud benefited insurance companies."
And Ways and Means Chairman Jason Smith called it the smoking gun.
He did. He argued the report shows how this broken system, which he says is shielded by Democrat policies, has led to the federal government shoveling tens of billions of tax dollars to insurance companies through identity fraud.
So the political argument is that this isn't just incompetence, it's a systemic choice.
That's the core of their argument, yes.
Which brings us to their proposed fix. If the problem is a structural failure of integrity, what's their alternative?
Their focus is all on program integrity reforms. They want full income and eligibility verification before any subsidies are issued.
So check first, pay later.
Exactly. Make verification mandatory and immediate, instead of letting people enroll and then maybe trying to check years later, if at all. And they want to end the anytime enrollment abuse through those special enrollment periods.
And is there any data suggesting that tightening these systems actually saves money?
They absolutely point to data. The Congressional Budget Office, the CBO, reportedly found that these kinds of integrity measures have already produced $185 billion in savings, and at the same time, reduced average premiums by about 0.6%.
So the counterpoint is that stricter verification doesn't just save taxpayer money, it could actually lower costs for everyone.
That's the powerful argument they're making.
So to summarize this whole deep dive, the GAO has made it crystal clear. The ACA marketplace has been on autopilot when it comes to fraud risk. It's allowing fake applicants to seize people's single SSNs linked to hundreds of policies to just exploit billions in taxpayer subsidies.
And that conscious decision to abandon the reconciliation check is the biggest vulnerability. It's created a $21 billion question mark over the entire program.
Which raises a really important question, doesn't it?
It does. Given that the GAO has been warning about these exact risks since 2014, and controls like tax reconciliation were explicitly paused for 4 years, is this system failing due to simple incompetence? Or is the lack of oversight itself part of the design to make sure coverage is maximized and money keeps flowing regardless of eligibility?
It's a frightening thought, and it leaves you with this. If 18 fake enrollees cost taxpayers over $10,000 a month in verifiable fraud, and we have $21 billion in subsidies with no required tax filing verification, how many true ghost enrollees are left wandering the system, quietly draining federal funds right now? That is something to mull over as Congress decides whether to extend these enhanced payments without fixing the system first.